Well, greetings again. This is Dr. Bill White with the American Orthodontic Society, and I want to talk to you a little bit this afternoon about moving teeth into areas where there's no bone. We have a young man here who's in what we call a scissor bite, where his upper teeth meet inside the lower teeth, and yet we had to examine this case, and it widened the upper arch out, and we carried the lower teeth almost a half inch out to the side, and people thought you could not move teeth into areas where there's no bone, and there's no bone out there, so they'd have to cut the jaw and move it out. But rather than that, we just put a large Big Daddy arch wire on it and expanded that, and you got an expansion on both sides, so we used elastics to make the expansion on one side only, the one that was where we had the scissor bite. So let me get into that and show it to you, and it can be done, and this is something that people think is wrong. We had a periodontist come by, and we were showing this, and he just swore him down. We moved the teeth out of the bone, but we did not. The teeth were in the bone, and he was in there for years after he left. So I'm going to get on to this right quick. Here the young man is. He's, I think, about 17 when we started this, and you don't see much in here, but one side of the mouth, the teeth are in a kind of the upper molars just miss the lower molars slightly. They're kind of chewing on the side of them. We call that a scissor bite, and we had to expand the upper and we had to expand the lower quite a bit to get them underneath the upper teeth there. So the lower teeth were expanded not a half inch, but it was close to that. So let's take a look. Here is Smile, a nice young man, real cooperative. Let's show you the teeth. Now we've got a whole stack of other orthodontic problems here, so we're not too interested in talking about all that right now. We got a lower bite, and we got cuspids that are actually crowded out. There's not room enough between the lateral and the bicuspids back here for these cuspids to come in. So we're going to expand the upper arches here, even though the upper arch is completely over the molars in the posterior part of the mouth on the left side of the person. So let me erase that and we'll go on. And this is another view of that same area, and you can see how the molar teeth, the lower molars, were inside and the upper molars were just sliding down beside them. We'll show that a little better later on. Over here the cuspid is crowded out, and these teeth fit right well in here, but we're going to have to widen this out to make room for the cuspids to come in, and when we did, we widened them and made the widening of the arch go in one direction. I want to show you that and make sure you understand how you can widen an arch in both ways. You just put something to expand it, but you got to put something that's moving it to one side or the other in a case like this. So here's this case that's showing the cuspids are crowded out. You can see there's no question about it. And so we're going to have to widen this upper arch out, to line the cuspids up, which we were able to do. There was no problem with that at all. And then open the bite. We did that with the lower was lined up down here, kind of not too much effort to increase the space down there to get those teeth in. And we'll go on. Now here we started this case in 4 of 89, so just remember that. It was April of 89, and the lower teeth were right up here in the roof of the mouth on one side, and here are the capped crowns of the lower teeth right over on this side. They're actually missing the upper molars right there. Let me get that out of the way so you can see it. This is the start of the case. And here, looking at it better, you got this bicuspid is in, but the molars is completely missing the lower molars. So we're going to widen these upper molars, and we're going to bring these teeth out to where they meet those. So for that to happen, we're going to have to move those teeth about this far. And that's not quite a half inch, but it's a lot of movement. And this periodontist that went by while we were showing that just swarmed down. We moved those teeth out of the bone. And people believe that. They've been taught that you can't move the teeth. People all the time, we're moving teeth where there's no bone. You take a kid and reach in there and suck in his thumb, pressing his teeth, and pushes his teeth out. It doesn't push his teeth out. The bone and the teeth all move out there. That happened. I had a man 45 years old who was trying to keep a lozenge up in his mouth, and he pushed his upper front teeth out. And we never figured out how he got them out there. With his tongue pressing against that gentle pressure, move those teeth out. So here we're going to bring these teeth out here, see, and then we'll get these cuspids down in here. But that's going to have these teeth even further, and we've got to bring these over so that the cusp of these teeth are hitting right into the center of the the upper teeth. Let's go on to here. Now here we took a large arch wire and expanded it maybe a half inch on either side over like this, pulled it in there and tied it to these teeth. And you get the same pressure on both sides. There's no question about that. You push on one side, it's going to push on the other side. And so these teeth over here and all of them are moving against each other to expand this arch. Now we wanted the expansion over here and not over here. So we hooked elastics to these teeth and come up in here like that. And then we got over here, we hooked elastics to them and came up on the outside of the teeth like that. Now the elastics are all pulling in one direction. So if you want to move a lower jaw in relation to the upper jaw or an upper jaw in relation to the bottom, it doesn't matter where. You can move the jaws around one on the other by just the way you put these elastics in. Now I'll have to show you how we did that. We got a video in here on that, but this big wire is way out here, a half inch, and we're pulling it in, and it is pushing out here, and it's pushing out over here. But we need the push or the expansion in this area right here, and not over here. So we want to hold this where it is, so we'll run elastics from here inside the lower, and over here from inside the lower to outside of the upper teeth like this. And that's going to be pulling the upper end and this out, and then that pulls on, and we're reducing the upper, but we put expansion in the arch anyway. Now here are the rubber bands. We're using this as a class 2 elastic right here, and this is 2. Now this elastic is the one coming from here on the outside of the lower molars to the inside of the upper molars. From the inside of the lower molar coming to the outside of the upper molars, and so our expansion is going to go in this direction. We're going to get expansion, whatever you do. You put this big wire in there and it'll expand anything. I've never run into a person that had a jaw you couldn't expand it with that large wire. But you have to put, if you're just using that, you'd have to put buccal root torque so that the roots go out, or else the crowns kind of do like that. You want the whole thing to go out. You put the buccal root torque in the arch wire, and then you put this expansion on, and in no way it will move the teeth out. I've never found a person that you couldn't expand their jaw. I don't care how old. I've got some deals on a guy that's 79 or 80 years old when we did that. And so that's where people, I don't know where we got the idea that the bone will not move around on people after 20 or 25 or years old. My teeth would move if I put braces on there, and I'm 94 years old, and they would still move. So you can forget about this old bull about your bones set and it won't move. It moves, and it moves in any age that we have. I mean, up until you're dead, it'll move. All right, we started putting this large wire in here in 11/30. That's another word, November the 30th of 89. And that was the start of that, what we call the Big Daddy arch wire. It's a crazy name, but that's what some of the students started calling it that. And so we just adopted that. Let's go. Now here we've expanded the upper, and we're getting the cuspids have come into place. So this is bigger than it was in here. Now here is the wire we're going to expand the bottom. We spread it out about a 1/2 inch on each side, and we tie it in here to the teeth that are fixed like that. Well, now it's pushing exactly the same over here as it is over on the right side as the left side. And the thing is, you want the expansion to go in this direction only, so you hook elastics here or on the other one and come over and then come up and hook it on the upper molar, the inside of the upper molar, hook it like that. So this elastic is pulling this out, and over here the teeth were right above, and over here the upper molars were out in this fashion up above. That's drawn wrong there. So we'd hook it from here to the outside of the upper, from the outside of the lower to the inside of the upper, and the whole thing will move in this direction. And you can do that anytime. You can slide the whole arch from side to side like that. And the bone structure in the arch moves with it and moves with the teeth. And you can look at the bone structure on these teeth. Now they're the ones this periodontist said they just were out of the bone. That's ridiculous. Okay, let's go to the next view here. And here we've got the teeth out there now. And so now we're using class 2 only, and we're pulling the bottom teeth forward a little and the upper teeth back some to get them to interdigitate properly. And here the lower arch is all lined up, and these are the teeth that used to be inside here, and we're missing the upper teeth. Out here, and the lower teeth came up something like this. And you can see a little bit of the wear on the upper teeth where they rubbed against those. We caught him at a young enough age to do that. Now here, this is 1990, and we're correcting the class 2 problem, and we're sliding the teeth back now to get these teeth to interdigitate like that. And we're using this elastic this way to do that. And you get a good cooperating patient, and you can do this. Now this, we were also using these little narrow brackets here. That's what we use nearly all the time. And that's, I can do anything anybody could do with any bracket near it. I don't know of anything they can do with that I can't do with those little bitty brackets like that. We can rotate the teeth and do all sorts of things. Okay, that's the upper now is expanded and the cuspids are in place, you see. Now on the bottom, we've got it expanded and the whole arch is moved over in this direction simply because of these elastics coming in here and coming in here like this. The elastic was pulling it one way and we were expanding the whole thing, and so all of it drifted to the left side of the mouth there. And let's get on, here it is. And we were using a rectangular arch wire. We have some little hooks and omegas back here, and we're wearing elastics like that. And the more level you get the elastics, the better you pull. You don't have so much vertical pull. If you pull from up here, you have a lot of vertical elevation of these teeth right here. So we drop the hooks down here and wore the elastics in that fashion. Now that's, the cuspids are blocked in. This is a distorted view, and I think I'll show it again here later how much we have widened that out. Now this is 4 of 90, and we started back in 89, and we've got this out that far, and the upper teeth now are lined up and they're hitting the lower teeth, you see, are coming right up into that groove on this. And we've got the class 2 corrected. These teeth are closed in there. We did that with these elastics, and we brought these out by having elastic hooked up here and inside the lower. Pull the whole thing to the side. All right, let's, now that's the same example. I don't know how that got messed up, but we bent the deal, taking the picture somewhere or another. All right, here is 1990. The lower is lined up. The upper is in class 1 now. You see this cuspid is way out here. We have it back in the class 1 relation, and these bicuspids are closing in. The molars are in class 1. Everything going back. Virtually the same thing over here. This could go a little further and get these points down in here, so you could wear a little more elastic on the left side of the mouth. And here is the young man after we got pretty well finished with. This is 1991, and this is finished, and we're holding him here for a while. And it's in class 1, and these teeth are spread out. Now these teeth have been moved nearly a ½ inch, and there is the bony ridge. You can palpate it. I don't care who you are. You don't have to skin that person to see that this is the bony structure right there. And you look on the inside, it left a little wider than it was, but this bone inside also. So the bone moves with the teeth. And if you just pull this over. So we're taking teeth and moving them where there is no bone, but we're taking the bone with us. That's the thing. You suck your thumb, your teeth stick out like this, and they're not out there by themselves. The bone structure moves with them. And this is done all the time. It's going on with everybody prizing around with their teeth. Move them, and the bone moves with the tooth. If you just take one tooth and try to shove it out, you can sometimes go through the bone structure. You'll strip it off. We see that every once in a while down on the bottom where there's a very thin area of bone over the labial surface of the lower roots down here. You can strip one if you just move one tooth. But you can take the whole group. And what we do, we wear lip bumpers when we're afraid they're going to strip, we push the tissue out away from the tooth where it's moving, and for the bone to go with the tooth, you've got to have some vascular tissue. In other words, you can't be pressing against the tissue and move the tooth into it, then you could move it through the bone structure. But if you take a lip bumper and push it down here, you can keep that lip bumper out in front of the teeth where you got a vacuum in your, the pressure in here doesn't have to push the tissue into the teeth, then the bone structure can develop and go right along with the teeth. And I think that's where people get messed up in there or get to thinking that that doesn't happen. But let's go through. Here is the upper arch, and that's the way it is. This is 91, it was 89 when we started. And we've got him out there, and the cuspid's in place, and got the lower arch there too. I think we have a distorted picture in here. Now here is this young man. He was 18 and 4 when we took this picture right here. I don't think we started this until he was in his in 1989. We started that. And here is 1991. So this is a year or two later, and we have widened this out, and you can see this expanded. Now here is age 18 and 4, and this is 89, and we started this in this area. And here is where the teeth were in the scissor bite. Now we widened that out. This is 1990, and he's age 19 and a half, and it moved out. And here's is 91, and we've got him out there. And here is 10 of 24 of 91, age 2011, and there the teeth are out in that area, and there's bone structure on the teeth, and where we move there'll be thicker bone will develop around these teeth here, more or less like it is on the other side of the mouth. So you can move teeth, and you don't have to surgically come in and section this jaw to move those teeth out. You can just put some pressure and hold it there, and you'll spread that out. Thank you for watching, and hope you'll join our group and subscribe to our channel, and we'd like to have you. And we've got over 600 of these videos on everything I can think of that's related to orthodontics. I don't think I have any child nursing, but nursing is important. And then you can you can move teeth and do all this stuff as long as people live. And we've got people that are not in their 90s. I never started them there, but I have worked into the 90s. So here's this young man, and we've just a picture of him on the way. And there's where the cuspids fit. And now we got this all the way back. We open the bite, and these cuspids are coming down in between the teeth. Now that's happened. Now, orthodontics is a marvelous thing, and you change people's lives. And I'm going to show you another video of what some people who did not think that you could move the teeth, what a ridiculous treatment they did. And so I'll show that in another video. I didn't take the pictures, but they gave me some pictures of that. But now this cuspid right here was hitting out here. Let's show it to you. It's hitting there. As we move that cuspid back, we brought it into the bone structure, and you'll see the tissue up here is thinner. That's natural on the cuspid and everything, but the tooth is coming in good, and we've got it, the overjet, the overbite is correct. And looking at it from first, they had the bite closed right there, and then we're open there now. He can slide his front teeth, slide the lower teeth forward, and bite on these two teeth together, and these won't hit back here. So you can cut some over the front without these teeth touching. Pulls the condyle up further, but it puts more pressure on the condyles when you chew on your front teeth. So you normally never bite hard with your front teeth. You stick it back in here and bite hard. And the molars, and the further back the molars are, the better the pressure is, and it's the muscles pulling back in here. And so this is why if you have a TMJ problem, it feels better if you bring it out here, but then you have a gap in here and it puts all the load from here to the condyles up on the back. And you've got to fill that in, and that is where a splint comes in. And so people have got to understand about splints. Here, you can see this cuspid is going right there, and we put it right, and that's where it wanted to be. And these are the teeth that were missing right here. We brought all of these out, something like this, and this came out further than that. So this moved about a half inch in here, and the bone structure followed the teeth. Now, if you look here, you can palpate and feel the bone structure. Those teeth are not out of the bone, and it is stupid for people to say, you've got to go in here and surgically section this section of the jaw and move it out to get the teeth to, or like they did in one place, they pulled all these teeth and put implants in and leaned them like that. It's such a ridiculous treatment. They could have put something in, like we put that large wire, and expand that, and then put those elastics and pull it sideways. It just takes a little time to do it, and I think it's worth the time for people to do that. Now here is where the upper teeth were. You see the distance across here, and you look at the distance here. Now the bone structure has been moved on these teeth just as well as the other teeth. I mean, we do it all the time. We expand and move teeth where there is no bone. We just move the bone with the teeth. And that's what you have to remember. The bone goes with the teeth. And these teeth right here, we've moved them out there, and the bone structure inside is just as good as it is. Well, it made a little bit thicker in here. We moved the teeth over, and this hasn't thinned down, but we still have good bone on the buccal side of those teeth. And if you look here, you can see this ridge around the bone structure. So there's a lot of marvelous things you can do with teeth. If you need to learn orthodontics. If you're going to mess with orthodontics, or if you're going to mess with dentistry, you ought to know some things about orthodontics. And this old idea of not teaching people these things because you're afraid they're going to do some of the orthodontics and the people would miss it. I hope we're forgetting that. And give the knowledge to everybody that's messing with people like that, so they'll know that if they don't want to do it, send it to somebody that knows how. If they don't know how to do it, God, take these videos to somebody and show them what you want, if that's what you want. And we brought them out like that. And there's the right side of the mouth, and there's the upper arch again. And we're going in the right direction. And we've got a 3 to 3 on it. And this is 1991, and this young man's 20 years and 7 months old right now, and we've taken him out of the braces, and this is his profile after we finished, and that's the end of our video, and I hope you get something from it, that you can do virtually anything you want to with the teeth. You can expand them, you can take the whole one arch and move it over one way or the other, and you coordinate the arches and make them fit into each other by just looking at them, see how much you got to reduce or expand the upper arch to get it over the lower arch. There's just all sorts of things you can do. So thank you for watching, and if you disagree with this, as the periodontist does, send me a note. If I'm wrong in this, I sure want to find it out, and I'll check out whatever you say and see if I don't believe it, and it is, if I'm wrong, I'll certainly admit it. But I don't think I'm wrong in this area. You can move teeth anywhere, whether there's bone or not. If you just take it easy, you can move the bone structure with the teeth in it. So thank you again, and I'm going to say goodbye, and we hope to see you again later. Thank you now.